Welcome to the Deep Dive. Today, we're going deep, deep into the world of hypertension.
A condition that's, well, it's often called the silent killer.
Yeah, silent killer, kind of a scary nickname. We're going to try to unpack why it's earned that name and what you can do about it.
Right.
We're diving into the research you provided, specifically the Hypertension 2024 document.
Okay.
To break it all down into easy-to-understand pieces and hopefully arm you with some knowledge to take control of your heart health.
Sounds good.
So let's jump right in. First, like, what even is hypertension? I mean, the research defines it as a persistent elevation of blood pressure, specifically systolic blood pressure at or above 140 millimeter Hg, or diastolic blood pressure at or above 90 millimeter Hg.
Right.
Can you kind of break down what all those numbers mean for someone who, isn't a doctor or anything?
Sure, yeah. So basically think of your heart as a pump. And every time it beats, it pushes blood out into your arteries.
Yeah.
That creates pressure against the walls of those blood vessels. And so systolic pressure, that's the top number, is the pressure when your heart beats.
Okay.
And diastolic pressure, the bottom number, that's the pressure when your heart's resting between beats.
So those numbers are kind of like snapshots of the pressure in your blood vessels.
Exactly.
At those different points in your heart's cycle.
Yeah.
Cool. Okay. Now, what about pre-hypertension? The source mentions it as this kind of like warning zone.
Right. Prehypertension is kind of that gray area where your blood pressure is. It's elevated, but not quite high enough to be classified as hypertension. So it's between 120 and 139 millimeter Hg systolic, or 89 millimeter Hg diastolic.
Got it.
And it's really a crucial time to start making lifestyle changes to prevent it from, getting worse.
So it's like a yellow light telling you to slow down and pay attention.
Exactly. It's like, hey, you need to start taking some steps to protect your heart health.
Yeah.
Yeah. Okay. Now, the research mentions that blood pressure is influenced by two main factors: cardiac output and systemic vascular resistance. And it even gives us this little equation: blood pressure equals cardiac output times systemic vascular resistance.
Right? Yeah.
I know you've used this analogy before, but I love it. Can you explain those factors, like in terms of highways and traffic?
Sure, yeah. So think of your blood vessels like highways.
Okay.
And cardiac output is the amount of blood your heart pumps out per minute. You can think of it as the number of cars entering the highway.
Got it.
And systemic vascular resistance is the resistance those cars encounter on the highway.
Okay.
So think narrow lanes, construction, or traffic jams.
Yeah.
The more cars entering the highway and the more resistance they encounter, the higher the pressure within the system.
So if your heart is pumping out a lot of blood and your blood vessels are constricted, you're going to have high blood pressure, just like a traffic jam on a busy highway.
Exactly.
At rush hour.
Yeah, that's a great way to visualize it. Yeah, I love that. Okay, so the source dives into the causes of hypertension and distinguishes between two types: primary and secondary hypertension. So can you kind of walk us through those two?
Yeah. So the vast majority of hypertension cases, we're talking about 90 to 95%, are classified as primary hypertension. It's also known as essential hypertension.
Okay.
And this means that there's no single identifiable cause.
So it's like a medical mystery in most cases.
In a way, yeah. Researchers are still trying to pinpoint the exact mechanisms.
Interesting.
However, for the remaining 5 to 10% of cases, there's a specific underlying condition that's causing what we call secondary hypertension.
So in those cases, you can kind of play medical detective and try to find the root cause.
Exactly.
What are some of the usual suspects?
Well, the source lists a bunch. Kidney disease is a common one, as the kidneys play a vital role in regulating blood pressure. Hormonal disorders like Cushing's syndrome can also lead to hypertension. And even certain medications, like some over-the-counter decongestants, can temporarily raise blood pressure.
That's a good reminder to always, talk to your doctor about any medications you're taking, even over-the-counter ones.
Absolutely.
Okay. So the source mentions that hypertension is often asymptomatic until target organ damage occurs.
Right.
That's a scary thought.
It is.
Can you maybe elaborate on that a little?
Yeah, unfortunately, hypertension often doesn't cause any noticeable symptoms until it's already damaging your organs.
Wow.
It's kind of like a thief silently breaking into your house.
Okay.
You might not realize they're there until they've already taken something valuable.
Yeah, that makes sense.
Yeah.
So what are some examples of target organ damage that hypertension can cause?
Well, hypertension can really wreak havoc on your cardiovascular system,
Uh-huh.
leading to heart attacks, strokes, and heart failure.
Hmm.
It can also damage your kidneys, your eyes, and even your brain. So, early detection through regular blood pressure checks is really crucial.
Okay. Yeah, that makes sense. So even if you feel fine, you could have high blood pressure silently damaging your body.
Right.
Are there any signs that might eventually appear, though?
Yeah, sometimes people with hypertension might experience fatigue, headaches, dizziness, or shortness of breath.
Got it.
But these they're often attributed to other causes, which again, it highlights the importance of those regular screenings.
Okay. Okay. So how do we make sure we're getting accurate blood pressure readings? I
Yeah,
mean, the source kind of outlines the proper procedure for that.
it does. It starts with being prepared. Avoid exercise, caffeine, nicotine, and alcohol for at least 30 minutes before the measurement,
Oh, okay.
because those can temporarily raise your blood pressure.
So no pre-checkup coffee runs.
Not a good idea. And also, make sure you're relaxed and comfortable. Sit with your back supported and your feet flat on the floor. And of course, the cuff size is really important. It should snugly fit around 80% of your arm's circumference.
Oh.
That's crucial for an accurate reading.
What about using a home blood pressure monitor? Are those reliable?
Yeah, home monitors can be really useful for tracking your blood pressure over time,
Mm-hmm.
but it's important to choose a validated device and use it correctly.
Yep.
Your doctor can help you select the right monitor and show you how to use it properly.
Awesome. Okay, so speaking of factors that can influence blood pressure,
Mm-hmm.
the source mentions this complex interplay of genetics and lifestyle.
Right.
Can you maybe unpack that a little bit?
Sure. So genetics definitely play a role in predisposing some people to hypertension.
Mm-hmm.
For example, genes involved in renal sodium reabsorption, meaning how your kidneys handle salt, can significantly influence your blood pressure.
Okay.
However, your lifestyle choices can either amplify or mitigate that genetic predisposition.
So you might be genetically predisposed to high blood pressure, but your lifestyle choices can either make it worse or help keep it in check.
Exactly.
That makes sense.
Yeah.
What are some of the key lifestyle factors that can contribute to hypertension?
Well, the usual suspects are stress, lack of physical activity, an unhealthy diet, especially one high in sodium and saturated fats,
Mhm.
excessive alcohol consumption, and smoking.
Right.
All of these can contribute to elevated blood pressure.
Yeah. And the source even mentions environmental factors like exposure to toxins and the fetal environment.
Yeah, it's amazing.
That's fascinating how many things can influence our blood pressure.
It really highlights the complex interplay of, nature and nurture in shaping our health.
Yeah, yeah. Okay, so now that we have a better understanding of what causes hypertension, let's move on to treatment options.
Okay.
Um, what are like the immediate and long-term goals when it comes to managing high blood pressure?
Okay. So the immediate goal is to get those blood pressure numbers down to a healthy range,
Okay,
ideally using the least amount of medication possible.
got it.
Right? We want to achieve control as safely and effectively as possible.
And in the long term, it's all about preventing those serious complications that we talked about earlier, like heart attacks, strokes,
Right.
kidney disease, and damage to other organs.
Exactly. We want to protect your overall health and well-being for years to come.
Yeah, yeah. Um, the source emphasizes that treatment should be personalized, taking into account each individual's unique circumstances.
Mm-hmm.
Can you maybe elaborate on that a little?
Sure, yeah. Every individual is different, and their treatment plan should reflect that.
Right.
We consider their overall health, risk factors, potential causes of hypertension, and any other medical conditions they may have. It's not a one-size-fits-all approach.
Okay. Okay. So before we dive into the world of medications, let's talk about lifestyle modifications. The source highlights those as cornerstones of hypertension management.
They are.
So can you kind of walk us through the key lifestyle changes that can make a real difference?
Yeah, absolutely. First and foremost, reducing sodium intake is paramount.
Mm.
Aim for no more than 5 to 6 grams of salt per day.
Right.
That might sound challenging, but even small reductions can make a difference.
Okay, so that's one. What else? What about alcohol?
Yeah, moderating alcohol intake is another key strategy.
Okay.
For men, that means limiting intake to 20 to 30 grams of alcohol per day.
Mhm.
and for women, 10 to 20 grams per day.
Okay, those are some good targets to keep in mind.
Yeah.
What about diet? Does the source recommend any specific dietary approaches for lowering blood pressure?
It does. It specifically mentions the DOSH diet.
DASH diet.
Yeah.
I like that. It sounds like a plan of action.
It is. It stands for Dietary Approaches to Stop Hypertension.
Oh, okay, that makes sense.
It's a balanced eating plan that emphasizes fruits, vegetables, whole grains, and low-fat dairy products while limiting saturated fat, cholesterol, and sodium.
So a heart-healthy diet that benefits your overall well-being.
Exactly.
I like it. Okay, so what about maintaining a healthy weight? I imagine that plays a role in blood pressure management as well, right?
Absolutely. Losing even a small amount of weight can significantly reduce blood pressure.
Okay.
The source recommends aiming for a body mass index, or BMI, of 25 kg 2 or less.
Right. BMI, for those who aren't familiar, is just a measure of body fat based on height and weight.
Right.
What about waist circumference? Does that factor in at all?
It does, yeah. Keeping your waist circumference within a healthy range is another important aspect of weight management.
Okay.
For men, the goal is to keep it below 102 centimeters or 40 inches. And for women, below 88 centimeters or 34 inches.
Okay, got it. And of course, we can't forget about the importance of regular physical activity, right?
Absolutely. Aim for at least 30 minutes of moderate intensity dynamic exercise most days of the week.
Okay.
Think brisk walking, swimming, cycling, or even dancing. Anything that gets your heart rate up.
Right, right. And if you can't fit in a full 30 minutes at once, even, shorter bursts throughout the day can add up.
Absolutely, yeah.
Okay, so we've talked about lifestyle modifications, but sometimes, medication is necessary to manage hypertension. So let's dive into that world, starting with diuretics. The source describes them as a common first-line treatment.
Right.
So what makes them so effective?
So diuretics essentially help your body eliminate excess sodium in water,
Okay.
which in turn reduces blood volume and lowers blood pressure. They act like a flush button for your system.
I like that. And within the diuretic family, thiazide diuretics are often the first choice.
They are, yeah.
Yeah.
They're effective at lowering blood pressure and are generally well tolerated.
But like all medications, they come with potential side effects, right?
That's true, yeah. Side effects can include things like electrolyte imbalances, particularly low potassium, as well as impaired glucose tolerance and increased serum lipid concentrations.
Okay.
They can also cause issues like impotence, loss of libido, diarrhea, and gout.
That's quite a list. Are there other types of diuretics besides thiazides?
Yeah, we also have loop diuretics and potassium-sparing diuretics.
Ooh, I'm curious about the potassium-sparing ones. What makes them different?
Well, as their name suggests, they help prevent the loss of potassium, which can be a side effect of other diuretics.
Okay.
This is especially important for people taking certain medications for heart conditions.
So they're like potassium protectors.
Exactly. But, as with all medications, it's essential to weigh the potential benefits against the risks.
Of course, yeah. Now, in addition to diuretics, another class of antihypertensive medications is sympatholytic drugs, and they work by targeting your nervous system.
Right.
So, nervous system, how does that help lower blood pressure?
Well, the sympathetic nervous system is responsible for the fight or flight response.
Okay.
It can increase heart rate, constrict blood vessels, and raise blood pressure. Sympatholytic drugs interfere with those processes, helping to relax blood vessels and slow down the heart rate.
So they essentially calm down the body's, stress response, which in turn lowers blood pressure.
Exactly, yeah.
Fascinating. The source mentions a whole array of sympatholytic drugs, including centrally acting drugs, ganglion blockers, adrenergic neuron blockers, and adrenergic receptor blockers. So let's start with those centrally acting drugs. How do they work?
So centrally acting drugs like methyldopa, clonidine, and guanfacine, they work by reducing sympathetic outflow from the central nervous system. They're essentially dampening those fight or flight signals.
So they're like calming the storm at the source.
Yeah, it's like a great way to put it.
I like that.
Yeah.
But I'm guessing they have potential side effects as well.
Yeah, like all medications, centrally acting drugs can cause side effects. Some common ones include sedation, dry mouth, and in the case of clonidine, a risk of rebound hypertension if the medication is stopped abruptly.
Rebound hypertension. That sounds scary.
It can be. It's essentially a sudden and potentially dangerous spike in blood pressure that can occur when certain medications are stopped too quickly.
Wow.
So it highlights the importance of following your doctor's instructions carefully and never abruptly stopping uh, any medication without their guidance.
Yeah, absolutely. Okay, what about ganglion blockers? What's their story?
So, ganglion blockers work by blocking nerve impulses at the ganglia, which are clusters of nerve cells. However, they block both sympathetic and parasympathetic ganglia, leading to a wide range of side effects.
So they're kind of like a blunt instrument
Yeah.
affecting more than just blood pressure.
Precisely. Because of their broad action and potential for side effects, ganglion blockers are rarely used for long-term management of hypertension. However, there's one exception: trimethophan.
Oh, what makes trimethophan special?
Trimethophan is primarily used for hypertensive emergencies,
Okay.
situations where blood pressure needs to be lowered rapidly to prevent organ damage. It's like the emergency responder of the antihypertensive world.
Got it. So it's reserved for those critical situations where rapid blood pressure control is essential.
Exactly, yeah. But even then, it comes with its own set of side effects.
Like what?
Things like postural hypotension,
Okay.
which is a sudden drop in blood pressure upon standing, which can cause dizziness or fainting,
Right.
as well as tachycardia, constipation, dry mouth, urinary retention, and even impotence.
Yikes. It's a reminder that powerful medications often come with powerful side effects.
They do.
Okay, let's move on to adrenergic neuron blockers. The source mentions two main players, guanethidine and reserpine.
hmm
How do those differ from ganglion blockers?
So adrenergic neuron blockers, as their name suggests, work by interfering with the function of adrenergic neurons, which are part of the sympathetic nervous system.
Okay.
They specifically target the release or storage of norepinephrine,
Mm-hmm.
a key neurotransmitter involved in the fight or flight response.
So instead of blocking nerve impulses at the ganglia, they interfere with the production or release of norepinephrine, essentially, cutting off the signal at its source.
That's a great way to put it.
By reducing norepinephrine levels, these drugs lead to a decrease in cardiac output and peripheral vascular resistance, ultimately, lowering blood pressure.
Yeah.
Sounds like a targeted approach, but I'm guessing these medications also have their share of side effects.
They do, yeah. Guanethidine can cause postural hypotension, especially after exercise, and it can lead to diarrhea and delayed ejaculation. Reserpine, on the other hand, is associated with sedation, nightmares, severe mental depression, diarrhea, and increased gastric acid secretion.
Okay, so as always, careful consideration of the risks and benefits is essential.
Absolutely.
Okay, so we've covered centrally acting drugs, ganglion blockers, and adrenergic neuron blockers.
Right.
What's left in the symptomatic drug category?
We still have adrenergic receptor blockers, which are probably the most well-known and widely used drugs in this category. They work by blocking specific receptors for norepinephrine and epinephrine, further dampening that fight or flight response.
Ah, yes. And the stars of this show are the beta blockers, right?
You got it. Beta blockers are commonly used to treat a variety of conditions, including hypertension. They work by blocking the effects of epinephrine and norepinephrine on beta adrenergic receptors. This leads to a decrease in heart rate and cardiac output, ultimately lowering blood pressure.
The source mentions a whole slew of beta blockers, which can be a bit overwhelming. Can you break them down into categories that make sense for the listener?
Certainly. So beta blockers can be classified as either non-selective or selective. Non-selective beta blockers, like propranolol, block both beta-1 and beta-2 receptors.
Okay, what does that mean in practical terms?
Well, beta-1 receptors are primarily found on the heart,
Got it.
while beta-2 receptors are found in the lungs and blood vessels.
Okay.
So blocking both types can have a broader range of effects.
The non-selective beta blockers are like the multitaskers of the beta blocker world.
You could say that, yeah.
Oh.
They're effective at lowering blood pressure and can also be used to to manage other conditions like migraines and certain types of tremors. However, they can also cause more side effects, particularly in people with lung conditions like asthma.
Ah, because they're also blocking those beta-2 receptors in the lung?
Exactly.
Okay.
And that's where selective beta blockers come in.
Right.
They primarily target beta-1 receptors in the heart, making them less likely to affect the lungs.
Got it. So if you have asthma or another, respiratory condition, uh, a selective beta blocker might be a better choice.
It could be. It's important to discuss your individual health history and concerns with your doctor to
Ah,
determine the most appropriate medication for you.
of course, yeah. The source mentions metoprolol and atenolol as examples of selective beta blockers.
Mhm.
Are those the most commonly used ones?
They are quite common, yes,
Yeah.
and they're generally well tolerated. However, like all medications, they can still cause side effects,
Okay, like what?
such as fatigue, cold extremities, and a risk of rebound hypertension if stopped abruptly.
That rebound hypertension seems to be a recurring theme with these blood pressure medications.
It is, yeah. It's a good reminder to always consult with your doctor before making any changes to your medication regimen.
Absolutely, yeah.
Yeah.
Okay, so the source also mentions beta blockers with intrinsic sympathomimetic activity.
Right.
That sounds a bit complex. Can you break that down for us?
Sure. These beta blockers are a bit unique because they partially stimulate beta receptors while also blocking them.
Okay.
This can be beneficial for patients with bradycardia or a slow heart rate.
So they're kind of like beta blockers with a built-in counterbalance
Yeah.
to prevent the heart rate from dropping too low.
That's a good way to think about it.
Oh,
Yeah. They offer some beta blockade, but with less of an impact on heart rate.
interesting. Okay. The source lists a few examples like isobutalol, cardiolol, penbidolol, and pindolol. It's amazing how many variations of beta blockers there are.
There are a lot. And within the adrenergic receptor blocker family, we have one last category to discuss: mixed alpha and beta blockers.
Mixed blockers. So they
Yeah.
block both alpha and beta receptors.
Precisely. Labetalol is a good example.
Okay.
It blocks both alpha and beta receptors, leading to a reduction in systemic vascular resistance without significant changes in heart rate or cardiac output.
So it's like a double whammy on those fight or flight responses.
Exactly.
Okay.
Labetalol is often used for hypertension associated with pheochromocytoma,
Mhm.
which is a tumor that releases hormones that can cause severe hypertension,
Okay.
and for hypertensive emergencies as well.
But even with its dual action, it still comes with potential side effects. Right?
It does, yeah.
Mm.
Labetalol can cause side effects similar to those of non-selective beta blockers,
Mhm.
such as fatigue, dizziness, and cold extremities.
Mm.
It's crucial to weigh the potential benefits against the risks for each individual patient.
Of course. Yeah. Okay, so we've explored diuretics and sympatholic drugs as treatments for hypertension.
Yeah.
What other options are available?
Another important class of medications is direct vasodilators.
Okay.
They work by directly relaxing the smooth muscle in the walls of blood vessels, leading to vasodilation.
Okay.
They're essentially widening those highways we talked about earlier, allowing blood to flow more easily and lowering blood pressure.
I love how you keep bringing back the highway analogy. It makes these concepts so much easier to visualize.
Good.
So direct vasodilators are like road construction crews,
Yeah,
clearing the way for smoother traffic flow.
exactly.
Perfect. Okay. So the source breaks down direct vasodilators into two main groups: arterial vasodilators and arterial and venous vasodilators.
Right.
Can you explain the difference?
Sure. So arterial vasodilators primarily target the arteries,
Okay.
which carry oxygen-rich blood away from the heart. They work by relaxing the smooth muscle in the walls of the arteries,
Okay.
reducing systemic vascular resistance.
And what about arterial and venous vasodilators?
So those, as their name suggests, target both arteries and veins. Veins carry deoxygenated blood back to the heart,
Mm-hmm.
so dilating them can also reduce the workload on the heart.
Interesting. So they're like expanding the capacity of the the entire transportation system,
Yeah,
both the outgoing and incoming lanes.
you got it.
Okay, now within the arterial vasodilators, we have hydralazine and minoxidil.
Right.
Minoxidil. Isn't that also used to treat hair loss?
It is, yeah. It's actually a fascinating story.
Yeah.
Minoxidil was originally developed as an oral medication for hypertension, but during clinical trials, researchers noticed that that patients taking the drug were experiencing unexpected hair growth.
That's incredible. What a happy accident.
It is.
But back to its role in blood pressure control,
Yeah.
how effective is minoxidil as a vasodilator?
It is quite effective, but it can cause a compensatory increase in heart rate and stroke volume,
Mhm.
leading to increased cardiac output and renal blood flow.
So the heart works harder to compensate for the lower resistance in the blood vessels.
Exactly.
Is that a problem?
It can be, yeah. This compensatory mechanism can lead to side effects like tachycardia, palpitations, and even angina in some individuals.
Okay.
Hydralazine can also cause these effects.
So these medications aren't suitable for everyone, I'm guessing?
They are potent drugs, yeah.
Okay.
They need to be used with caution.
Of course. Now, in addition to hydralazine and minoxidil, the source also mentions diazoxide as an arterial vasodilator.
Right.
What's diazoxide used for?
Diazoxide is a long-acting arterial dilator, primarily used for
Welcome back to our deep dive into hypertension. You've already learned quite a bit about what causes high blood pressure and some of the medications used to treat it. Now, before we jump into combination therapy, I'd love to hear like what stood out to you from the first part.
Well, it's fascinating how many different factors contribute to hypertension, from genetics and lifestyle choices to environmental factors and underlying medical conditions. It really underscores the importance of a holistic approach to managing blood pressure.
Yeah, I agree. And it's incredible how many different medications are available, each with its own unique mechanism of action and potential side effects. It's like a complex puzzle, figuring out the best approach for each individual.
Precisely. That's why it's so crucial to work closely with your healthcare provider to develop a personalized treatment plan.
Absolutely, yeah. Okay, so now let's delve into combination therapy, which the source highlights as a common strategy for managing hypertension.
Hmm.
Why is combining different medications sometimes necessary?
Well, sometimes a single medication isn't enough to achieve optimal blood pressure control.
Yeah, okay.
Combining different medications with complementary mechanisms of action can create a synergistic effect, meaning they work better together than they would individually.
So it's like having a team of specialists working together to tackle the problem from different angles.
Exactly, and by using lower doses of each medication, we can often minimize side effects while maximizing effectiveness.
That makes sense. What are some of the most common and effective combinations for treating hypertension?
One common approach is combining a thiazide diuretic with a beta blocker. This combination addresses both volume overload and the overactivity of the sympathetic nervous system.
I remember we talked about thiazide diuretics,
Hmm.
helping the body eliminate excess sodium in water.
Right.
And beta blockers, as you explained, help slow down the heart rate and reduce the force of heart contractions.
Right. So together they create a balanced approach to lowering blood pressure.
Okay. Another combination mentioned in the source is an ACE inhibitor, or ARB, with a calcium channel blocker.
Hmm.
Can you remind us how those medications work?
Sure. So AC inhibitors and ARBs, as we discussed earlier, target the renin-angiotensin system, which plays a key role in regulating blood pressure.
Hmm.
They essentially block the actions of angiotensin II, a potent vasoconstrictor.
Right, right. And calcium channel blockers, if I recall correctly, work by blocking the influx of calcium into smooth muscle cells,
Yes,
preventing them from contracting and allowing blood vessels to relax.
exactly. So combining an ACE inhibitor or ARB with a calcium channel blocker can address both vasoconstriction and the potential for fluid retention.
It's like a multi-pronged attack on hypertension.
You could say that.
Yeah.
And the beauty of combination therapy is that it can be tailored to the individual patient. We can choose medications from different classes based on their specific needs and medical history.
So it's not a one-size-fits-all approach.
Right.
Each treatment plan is like a custom-tailored suit
That's a great analogy.
designed for optimal fit and function.
I like it.
Okay. Now, before we wrap up this deep dive, let's take a step back and connect all this information to the bigger picture, like the key takeaway message for our listener.
Well, I think the most important message is that hypertension is a serious condition, but it's manageable. With early detection, lifestyle modifications, and appropriate medication, we can significantly reduce the risk of complications and improve long-term health outcomes.
That's reassuring to hear, but it also, puts a lot of responsibility on the individual to take charge of their health.
Absolutely. Knowledge is power, and the more you understand about hypertension, the better equipped you'll be to make informed decisions about your health.
We've certainly armed you with a lot of knowledge in this deep dive, from understanding the causes and risks of hypertension to exploring a wide range of treatment options.
We've also emphasized the importance of accurate blood pressure measurement and discussed the potential role of lifestyle modifications in both preventing and managing high blood pressure.
Speaking of lifestyle modifications, let's recap those key strategies that can make a real difference.
Of course. First and foremost, reducing sodium intake is crucial. Aim for no more than 5 to 6 grams of salt per day.
Right.
Okay.
That can be a challenge for some people. But, even small reductions in salt intake can have a positive impact.
Absolutely.
Okay, so that's one. What else? What about alcohol?
Yeah, moderating alcohol intake is another key strategy.
Right.
For men, that means limiting alcohol to 20 to 30 grams per day, and for women, 10 to 20 grams per day.
Okay. Those are good guidelines to keep in mind.
Yeah.
What about diet? What kind of dietary changes can help lower blood pressure?
So the source specifically mentions the DASH diet, which stands for Dietary Approaches to Stop Hypertension.
Right.
It's a balanced eating plan that emphasizes fruits, vegetables, whole grains, and low-fat dairy products, and it limits saturated fat, cholesterol, and sodium.
Sounds like a healthy and delicious way to eat.
It is.
Yeah.
And studies have shown that the DASH diet can effectively lower blood pressure.
Okay, great. What about maintaining a healthy weight? I imagine that plays a role in blood pressure management as well.
Absolutely. Losing even a small amount of weight can have a significant impact on blood pressure. The source recommends aiming for a BMI of 25 km2 or less.
Right. And remember, BMI stands for body mass index, which is a measure of body fat based on height and weight.
Right.
What about waist circumference? Does that factor in at all?
It does. Keeping your waist circumference within a healthy range is another important aspect of weight management. For men, the goal is to keep it below 102 centimeters or 40 inches. And for women, below 88 centimeters or 34 inches.
Okay. Those are some concrete targets to aim for.
Yeah.
Finally, what about physical activity?
Regular physical activity is essential for maintaining a healthy blood pressure. The source recommends at least 30 minutes of moderate intensity, dynamic exercise most days of the week.
Right. Think brisk walking, swimming, cycling, or dancing.
Yeah.
Anything that gets your heart rate up and your blood pumping.
Exactly. And remember, even if you can't manage 30 minutes all at once, breaking it up into shorter bursts throughout the day is still beneficial.
Yeah, absolutely. Okay, so we've covered a lot of ground in this deep dive, from defining hypertension and exploring its causes to diving deep into the various classes of antihypertensive medications and discussing the importance of lifestyle modifications. But before we wrap things up, the source makes an interesting point about CVD risk factors that are common in patients with hypertension. It breaks them down into modifiable and relatively fixed risk factors. Can you explain the difference between those two categories?
Sure. So modifiable risk factors are those we have the power to change through, lifestyle choices and medical management. These include things like smoking, diabetes, high cholesterol, obesity, physical inactivity, and an unhealthy diet.
Those all sound familiar. We've already touched on most of those as contributing factors to hypertension.
Exactly. By addressing these modifiable risk factors, we can not only manage hypertension, but also reduce our overall risk of developing cardiovascular disease.
Okay, great. What about the relatively fixed risk factors? Those sound a bit more daunting.
They are, but it's still important to be aware of them.
Okay.
These include factors like increasing age, family history of cardiovascular disease, chronic kidney disease, being male, and low socioeconomic status.
Some things we can't change, but being aware of them allows us to be more proactive about managing the risk factors we can control.
Precisely. It's all about taking a holistic approach to our health.
Yeah.
Understanding both our modifiable and relatively fixed risk factors allows us to create a personalized plan for preventing and managing cardiovascular disease.
Okay. Now, in addition to those factors, the source also mentions obstructive sleep apnea and psychosocial stress as contributing to hypertension. Can you talk a bit about those?
Sure. So obstructive sleep apnea, or OSA, is a condition where your breathing repeatedly stops and starts during sleep.
Okay.
This can lead to surges in blood pressure and put a strain on your cardiovascular system.
So even when you're sleeping, your body might be working overtime to compensate for those breathing interruptions.
That's right. And over time, this can contribute to the development of hypertension.
Okay. What about psychosocial stress? How does that play into the picture?
So psychosocial stress encompasses a wide range of factors, including work stress, financial worries, relationship problems, and social isolation. These stressors can trigger the release of hormones like adrenaline and cortisol, which can temporarily raise blood pressure.
So it's like our bodies are constantly reacting to the pressures of modern life.
Right.
And if those stress responses become chronic, it can take a toll on our cardiovascular health.
Exactly. Chronic stress can contribute to persistent elevations in blood pressure, increasing the risk of developing hypertension.
It seems like there's a complex interplay between our physical and mental well-being.
There is.
Both play a role in shaping our cardiovascular health.
Absolutely. That's why it's essential to address both physical and psychological factors when managing hypertension. Lifestyle modifications like exercise, relaxation techniques, and stress management strategies can be just as important as medications in some cases.
So it's not just about popping pills. It's about making sustainable changes to our lifestyles that support our overall health and well-being.
Precisely.
Okay, this has been an incredibly insightful exploration of hypertension and its management.
It has.
We've covered a lot of ground in this deep dive, from understanding the causes and risks of hypertension to exploring a wide range of treatment options and discussing the importance of lifestyle modifications. But before we wrap things up, I want to touch on something that often causes confusion. White coat hypertension. Can you explain what that is and why it matters?
Sure. White coat hypertension refers to a phenomenon where your blood pressure readings are elevated in a clinical setting, like a doctor's office, but are normal when measured at home or in other non-medical settings.
So it's like your body gets stage fright when it's in the doctor's office.
You could say that, yeah. It's thought to be triggered by anxiety or stress related to the medical environment.
Okay, why is it important to distinguish between white coat hypertension and true hypertension?
Well, true hypertension requires medical management, while white coat hypertension may not. Treating someone for hypertension when they only experience elevated readings in a medical setting could lead to unnecessary medication use and potential side effects.
Right. That makes sense. So how do doctors determine whether someone has white coat hypertension or true hypertension?
One way to differentiate is through ambulatory blood pressure monitoring. This involves wearing a portable blood pressure monitor for 24 hours, which records your blood pressure at regular intervals throughout the day and night.
So it's like having a 247 blood pressure diary.
Exactly. This provides a more comprehensive picture of your blood pressure patterns and can help identify whether those elevated readings are truly persistent or only occur in specific situations.
That's fascinating. So if someone suspects they might have white coat hypertension, they should talk to their doctor about ambulatory blood pressure monitoring.
Absolutely. It's a valuable tool for making an accurate diagnosis and ensuring appropriate treatment.
We've covered so much ground in this deep dive, from defining hypertension and understanding its causes to exploring various treatment options and addressing common misconceptions. I'm curious to know what stood out to you the most. What insights or aha moments will you take away from this exploration?
Well, for me, it's the emphasis on the individuality of hypertension management. There's no one size fits all approach. Treatment plans need to be tailored to each person's unique circumstances, taking into account their medical history, lifestyle, and personal preferences.
I agree. It's a reminder that healthcare is a collaborative process. We need to work together with our healthcare providers to develop a plan that feels right for us.
Absolutely, and it's empowering to know that we have a voice in our own healthcare. We can ask questions, advocate for our needs, and actively participate in making decisions that affect our health.
Speaking of taking charge, the source highlights a few important points about the overall management of hypertension. It stresses the importance of early detection and ongoing monitoring. Can you elaborate on those aspects?
Of course. Early detection is crucial because, as we discussed, hypertension often doesn't have any noticeable symptoms until it's already causing damage.
Right.
Regular blood pressure checks starting in young adulthood are essential for catching it early and preventing complications.
So even if you feel perfectly healthy, it's important to get those blood pressure checks.
Absolutely. Think of it as preventative maintenance for your cardiovascular system.
I like that. Okay, what about ongoing monitoring? Why is that important?
Well, blood pressure can fluctuate over time. It can be influenced by factors like stress, diet, exercise, and even the time of day.
Mm.
Regular monitoring allows us to track those fluctuations and make adjustments to treatment plans as needed.
So it's like a feedback loop, constantly assessing and fine-tuning our approach to blood pressure management.
Exactly.
This has been an incredibly informative journey into the world of hypertension. We've explored its causes, its risks, and the various strategies for managing it. But before we conclude our deep dive, I want to leave our listener with a final thought-provoking question. What what small but significant changes can you make today to prioritize your cardiovascular health? It's a question worth pondering. Even seemingly small adjustments to our lifestyles can have a ripple effect on our overall health and well-being.
I wholeheartedly agree. It's those small, consistent steps that often lead to the most significant and lasting changes.
We'll be back soon for the final part of our deep dive into hypertension. Until then, take care of yourselves and keep those hearts healthy. Welcome back to the deep dive. We're wrapping up our exploration of hypertension, and I gotta say I've learned so much from this deep dive. It's amazing how much information is packed into this research.
It really is. It's a testament to the complexity of this condition, and the ongoing efforts to understand and manage it effectively.
Yeah, absolutely. And I think we've done a pretty good job of unpacking that complexity and presenting it in a way that's both informative and engaging, right?
I think so, yeah. We've covered a lot of ground from the basic definitions and mechanisms of hypertension to the various treatment options and the importance of lifestyle modifications.
And we've highlighted the individuality of hypertension management, emphasizing that there's no one size fits all approach.
Right, exactly. Each person's journey with hypertension is unique, and their treatment plan should reflect that.
Absolutely. Before we sign off, I want to circle back to something we touched on earlier, the silent killer aspect of hypertension.
Yeah.
It's a powerful image, but I'm wondering if you could elaborate on why it's so important to take this aspect seriously.
Sure. The silent killer moniker really stems from the fact that hypertension often doesn't cause any noticeable symptoms until it's already causing damage to vital organs.
Right.
This is why regular blood pressure checks are so crucial. They allow us to detect hypertension early, even before symptoms appear, and take steps to prevent or slow down that damage.
So it's like having a smoke detector in your house.
Hmm.
You might not see the fire, but the alarm alerts you to the danger before it's too late.
That's a great analogy.
Yeah.
Yeah. Early detection is key to preventing those long-term consequences of hypertension, like heart attacks, strokes, kidney failure, and vision problems.
And those consequences can be, life-altering. It's not something to take lightly.
Absolutely not. Hypertension is a serious condition, but it's manageable with the right knowledge and a proactive approach.
Now, I know we've discussed a wide range of treatment options from lifestyle modifications to various classes of medications, but I'm wondering if you could offer some final words of wisdom for our listeners. What's the most important message you want them to take away from this deep dive?
Well, if I had to distill it down to one key message, it would be this: take control of your heart health. Don't wait for symptoms to appear. Be proactive. Get regular blood pressure checks. Make healthy lifestyle choices, and work closely with your healthcare provider to develop a personalized management plan that's right for you.
That's a powerful message, and
Yeah.
it's a reminder that we're not passive bystanders in our own health journey. We have the power to make choices that can significantly impact our well-being.
I couldn't agree more. Knowledge is power, and we've certainly empowered you with a wealth of knowledge about hypertension in this deep dive.
Armed with this knowledge, you can now engage in more informed conversations with your healthcare providers, make healthier choices, and ultimately take charge of your cardiovascular health.
Hmm.
Remember, even small changes can make a big difference over time.
That's absolutely true. It's those consistent, everyday choices that add up to create a healthier and more fulfilling life.
Well said. Thank you for joining us on this deep dive into hypertension. We hope you found it informative, engaging, and empowering. And remember, keep those hearts healthy.